transition from your intern year to your CA1 year can be a really nerve-wracking time. I know I was actually very anxious about it, but I think Pitt does a great job of slowly easing you into things. First, you start off with a 2-week boot camp. During this, you do a lot of anesthesia simulations and also learn things you never really did in medical school. Things like troubleshooting IVs, working the Alaris pumps, checking the anesthesia machine in the mornings to make sure that it's functioning correctly. After that, you move on to a buddy system where you're paired up with another CA1 resident and working in the ORs together. During this time, you're also one-on-one with either an attending or a senior resident. All this support just helps you feel a little more comfortable in the operating room. You learn where all your supplies are, and generally just more comfortable doing anesthesia. After that, then you're finally out on your own and doing the anesthesia by yourself as you would any other resident. I think the 2-week boot camp and this buddy system helps make the transition a little bit smoother, a little bit easier, so that you don't just go from an intern to all of a sudden being in the ORs by yourself.
Working in the operating room has a particular flow to it that you get used to very quickly. Getting ready for the OR actually starts the day before, when the OR assignments are posted around 3 p.m. You look up which OR and attending you are working with the next day, then chart review your patient's medical history and anesthesia record. After you develop an anesthesia plan, you call your attending to discuss the plan and educational topics. The next morning, most residents arrive around 5:45. This gives you time to check out the anesthesia machine, set up any special monitors like an A-line, and get all your medications ready. Your goal is to see the patient by 6:30 so you can conduct an interview and physical exam, put in an IV, obtain consent, and answer any questions they might have about the anesthesia plan. Around 7 a.m., you roll back to the operating room and start your case. You can do anywhere from one big case to maybe 4 or 5 smaller cases. Relief is at 5 or earlier on lecture days. This gives you time to attend your lectures and grand rounds during the week. After that, your day starts over again with finding your OR assignment and looking up your patients. Unless you're on call, you do not work most weekends, so you have plenty of time to read and time for wellness, as well as exploring Pittsburgh.
Hey everyone, here to talk about CA1 year at Pitt. Our focus is really to get you comfortable in the OR during your CA1 year and also build a foundation of anesthesia knowledge for the rest of your residency. So for the first half of the year, you're in a general OR setting. You will go to different hospitals during that time. You switch off about every month or so, and all of those hospitals are within a 5 to 10 minute drive of each other. They're all really close. But we find that going to different sites really helps with your adaptability as a provider. And also gives you exposure to a lot of different methods of anesthesia delivery. So you get to not only work with a multitude of different attendings, but also see how the anesthesia delivery works at different hospitals with different flow and different just methods of working in the operating room. So that really gives you a lot of experiences to choose from. Additionally, in your CA1 year, after you've done that first half of general OR, you are open to take subspecialties, which you can request as a CBY. So you can do anything from chronic or regional pain to OB and even pediatrics in your CA1 year, which is super helpful when you are trying to decide which fellowships you're interested in, if you are. And so you get a lot of exposure to different subspecialties really early, which can be a really valuable experience. So hope that helped.
One of the things that I love about our residency program is its dedication to resident education. Every week, the CA 1, 2s, and 3s meet on separate days to have a lecture from one of our faculty members. The lecture is from 3 to 4, and it's geared for each class. So the CA 1s might learn about some of the basic things like gas laws or machine mechanics, while the CA 3s will learn about things like negotiating contracts. Not only are these fantastic learning opportunities, but they also give us a chance to come together as a class and see how everyone's doing on their different rotations. In addition, on Thursdays, we have problem-based learning discussion, or PBLD. The CA 1, 2s, and 3s are divided into 2 groups alphabetically, each meeting on every other week. A faculty member will come up with a clinical scenario, and we have to come together as a group to come up with a solution. It's fantastic prep for the oral boards. In addition, it's also awesome to hear how some of our senior residents would solve some of these clinical problems. In addition, twice a month, we have either Journal Club or Grand Rounds. Journal Club is ran by our CA1 class, where a paper is chosen that's either practice changing or relatively new to our field, and we discuss the strengths and weaknesses of the paper and also discuss the statistical analysis of it. Grand Rounds is either given by one of our faculty member or by a visiting faculty member, and it could be on a variety of topics. Our residency feels so strongly about resident education that we've actually hired additional staff to make sure that we're relieved from our clinical duties in order to make these sessions on time. One of the other nice benefits is that unless you're on call that night, once these educational sessions are finished for the evening, you're able to go home and enjoy the rest of your evening.
Taking call as a junior resident is a unique experience in our program. Rather than being the hands-on provider for the duration of a case, we get to see all cases throughout the night and sort of act as proceduralists, assisting our nurse anesthetist, senior resident, and attendings in starting cases. This allows us to get involved with cases that are pretty complex and those that would be really above our skill level if we were the day resident covering these cases. Examples include heart and lungs transplants, emergent neurosurgical procedures, polytraumas, and a variety of other types of cases. It's definitely not uncommon to place multiple A-lines, central lines, and even double lumen tubes as a junior resident on call. We are a level 1 trauma center, so we see everything, and this is going to prepare us well to handle a myriad of complex situations once we graduate from residency.